10 warning signs that your heart's not working properly. According to the Centers for Disease Control and Prevention, about 610,000 people die from heart disease each year in the U.S. alone. There are tons of factors that can cause a person to develop heart problems, but most of them come down to poor lifestyle choices. The good news is that your body gives you signs and warnings early on so that you can catch an illness in its early stages or even prevent it altogether. So here are 10 of the most common red flags that indicate bad heart health. If you notice any of them, consult your doctor immediately. 10. Pain that spreads to the arm. If their heart isn't working properly, a lot of men feel pain in their left arm, while women experience the same pain in either or both arms. Some women also report experiencing unusual pain in the elbow right before having a heart attack. This happens because the pain from your heart travels to your spinal cord where tons of your body's nerves are connected, so your brain gets confused and thinks that your arm is physically hurting when it's really not. 9. A cough that won't quit. A persistent cough can be a symptom of all kinds of health issues, and cardiovascular disease is one of them. For instance, a chronic cough that produces a pinkish bloody liquid is very common in people with heart failure. Despite what it sounds like, heart failure doesn't mean that the heart completely stops beating. It just means that a person's heart isn't pumping blood as well as it should be. As a result, the body doesn't get enough oxygen since it's carried to all the tissues by the blood. However, chronic cough can be a subsymptom of a much more serious symptom called dyspnea, or sudden loss of breath. This may also indicate serious heart disease. 8. Swollen legs, ankles, and feet. When your heart isn't pumping enough blood through the body, fluid from your blood vessels leaks into surrounding tissues. Your lower extremities are the most affected simply due to gravity. This condition is called peripheral edema, and many people who suffer from it don't, in fact, have heart problems. Such swelling may appear due to liver malfunction, hypertension, pregnancy, injury, altitude sickness, or even when you sit without moving for a long period of time. But still, it's quite common among people with heart disease, so you should pay close attention to it. 7. Nausea and loss of appetite. A lot of heart disease patients show a lack of appetite, nausea, or both, even if they've just had a couple bites of food. The reason for that is built-up fluid around the liver and intestines that interferes with proper digestion. These symptoms are usually accompanied by abdominal pain, upset stomach, or feeling bloated. In fact, abdominal cramps that come and go in short spurts are extremely common right before a heart attack. So if you're experiencing several of these symptoms at once, you should see your doctor immediately. 6. Extreme levels of anxiety. Several studies by the American Heart Association have shown that people who suffer from extreme anxiety from a very early age or most of their life are more prone to developing coronary heart disease. Anxiety can be caused by either a really stressful lifestyle or different problems like reoccurring panic attack and strong phobias. Some of the effects anxiety has on your heart include tachycardia or abnormally rapid heart rate, increased blood pressure, which over time can lead to coronary heart disease, and decreased chance of surviving a heart attack. 5. Lightheadedness or fainting. Feeling lightheaded and experiencing temporary loss of consciousness, also known in the scientific community as syncope, is super common among heart patients. Like we mentioned earlier, when the heart isn't pumping enough blood to all the organs and tissues, they don't get the sufficient amount of oxygen they need. Well, the brain is affected by this oxygen depletion too. And if blood flow is being blocked by a clogged artery or the narrowing of a valve, it can result in an extremely threatening and potentially fatal condition called cardiac syncope. Those who are at a higher risk of dying from cardiac syncope include people age 60 and older. Those with a known heart condition, men more so than women, and people who often faint during exertion or while laying on their back. If you ever feel shortness of breath and pass out easily, call a doctor immediately and have your heart checked. 4. Your skin becomes paler or takes on a bluish tint. Being naturally pale doesn't necessarily mean you have a heart condition, but sudden paleness can be a result of reduced blood flow due to a heart that's not pumping blood as effectively as it should be. Shock, which can be caused by any condition that prevents the blood in your body from circulating properly, is the main reason why people who are suffering from a heart attack or heart failure turn pale all of a sudden. This shock-induced paleness can appear all over the body or on a certain body part, like a limb. If you notice that you've gone pale recently, don't panic. Check whether you're suffering from shock or if it's from some other issue like decreased number of red blood cells, a condition called anemia. 3. Skin rashes or unusual spots. 2 separate studies, one published in the Journal of Allergy and Clinical Immunology and the other conducted by the American College of Cardiology, showed that eczema and shingles are high risk factors for developing heart disease. People with eczema were found to have a 48% chance of suffering from high blood pressure and a 29% possibility of having high cholesterol. They also found that those with shingles were 59% more likely to have a heart attack than people who don't have this condition. 2. Chronic or sudden fatigue. Fatigue can be one of the main symptoms indicating an impending heart attack. Women are more likely to experience heart-related fatigue than men, with 70% of female heart attack patients reporting that they'd felt extremely tired before their episode. Physical or mental activity isn't the reason for such exhaustion, and it increases by the end of the day if it's due to a failing heart. It's really hard for this symptom to go unnoticed. Sometimes it's exhausting just to perform even the simplest task, like making the bed or taking a shower. 1. Increased perspiration. Excessive sweating can also be an early warning sign of an upcoming heart attack. It might occur at any time of day or night. Again, this symptom is seen in women more often than in men. The scary part is that it's all too often confused with hot flashes or night sweats, both of which are typical in menopausal women. People experience flu-like symptoms, have clammy skin, and sweat regardless of the air temperature or physical exertion. Sweating seems to be more excessive at night, and you often see damp bed sheets by morning. The areas that sweat the most are the palms, feet, top of the head, and chest. Remember that prevention is better than cure. You can do your heart good by maintaining a healthy lifestyle in which exercise plays a major role. Avoid fried or processed food, and staying as far away as possible from smoking and excessive alcohol consumption. It's also worth mentioning that the symptoms we've discussed today don't necessarily appear in every heart disease patient, but they are some of the most common warning signs of this affliction. So stay alert and take care of yourself. Do you know any other symptoms that are a red flag for approaching heart disease? Let us know in the comments below. And remember to hit the like button and subscribe to our channel. This way you'll stay with us on the bright side of life.